Good afternoon and welcome to day 2 of our Learning Together week. My name is Ravinda Condell. I'm the Senior Safeguarding Programme Manager in the National Safeguarding Team and your host for today's session. Before we start, just a little bit of housekeeping. You are viewing today's event via MS Teams Live. All camera and microphone functions have been disabled. If you are having technical problems, try logging in using Google Chrome. Today's presentation will be recorded and will be available shortly after the session, along with the presentation slides via our Future NHS platform, where you will also find recordings from our previous events. For those of you who are not already registered on Future NHS, you'll need to complete an easy registration process. If you have an nhs.net, nhs.uk or a .gov.uk email address, then you can self-register. The registration link for Future NHS has been posted in the chat box. You can also follow us on Twitter via @NHS Safeguarding to keep updated on safeguarding issues. This week will be a very difficult listen. If you need to stop and take a break, please do so. Also, if you need support, please do contact the safeguarding team via england.safeguarding@nhs.net, and we are here to listen. There will be a Q&A session at the end of this presentation. Please do use the chat box to ask any questions. Your questions will be themed by Kenny Gibson, Deputy Director for Safeguarding, and put to the presenter. Any questions not addressed will form a frequently answered questions document, which will be again posted onto Future NHS. A link to a feedback form will be posted in the chat box. We urge you to complete this form as the feedback helps us with how we deliver our future Learning Together weeks. Next slide, please. Finally, why not download our NHS Safeguarding app via Apple or Google Play, or the QR code on your screen. If you have any questions or amendments that need to be noted on the Safeguarding app, please email the Safeguarding team. I would now like to introduce you to today's speaker, Kevin Johnson from the National Fire Chiefs Council, who will be speaking today about the factors which influence pervasive cultures and hoarding visits from the fire and rescue services.
Thank you very much, Ravinda. Yeah, good morning. As I say, my name is Kevin Johnson and I chair the Safeguarding Practitioners Group for the National Fire Chiefs Council. Whilst I do that nationally, I actually work and I'm based in Merseyside Fire and Rescue Service. What I'm going to speak about today really is what hoarding is or isn't, the potential causes of hoarding and the effects it can have on individuals, their families and the partner agencies. And I'll be particularly picking on some of the fire risks and problems that we come across. I'll finish it with a case study, which is actually from Merseyside Fire and Rescue Service. And it was a double fatality that we attended at a hoarder's property in Liverpool. So that will be the case study at the end. Can I have the next slide, please? Okay, hoarding disorder. What is a hoarding disorder? I mean, the definition on the slide there is actually from the NHS UK website, and it says a hoarding disorder is where someone acquires an excessive amount of items and stores them in a chaotic manner, usually resulting in unmanageable amounts of clutter. These items can be of little or no monetary value. So essentially, it's a mental health disorder, and the individual will have difficulty disposing of possessions that are potentially no longer useful for them or actually serve no purpose, but they just can't get rid of them. Most people, even think about yourself, will have trouble getting rid of possessions at some point, and that could be following the death of a relative or friend, or when you're moving home, and some objects obviously do have that sentimental value. However, someone who does have a hoarding disorder will have issues getting rid of any items at any time, and they put some kind of value on it, even though actually there probably isn't there. And when you try and help someone do this, you can actually add significant stress to them by trying to help them get rid of these items. And I'm sure everyone's seen on TV these hoarding shows where, you know, the crew go in and miraculously clear it within, you know, a week. I think realistically, we all know that doesn't happen. And there's a point where, you know, previously there's an element of people, hoarders, were, you know, a bit of a nuisance, maybe a little bit eccentric, and I think we've moved past that now. And as I say, when we touch on a case study, I think that will show the seriousness of where we are with hoarders. One of the consequences, and this is from a fire service perspective, of people who are suffering with a hoarding disorder, is it can get to a point where individuals can no longer use their house for the function it was designed for. So this in turn will cause people to change their behaviours. Now, those behavioural changes and not using the property for the reason it was designed for will make people unable and make probably risks around cooking, cleaning, sleeping, washing, and this will add a considerable risk to falls and fire in the home. So that's what we'll look at as we move on. Next slide, please. Okay, there's three different areas really: clutter, collecting, and hoarding. And we do need to distinguish between these three areas because the support that we offer people will differ considering where they are within these areas. We always, from a fire service perspective, we go into people's property. We're non-judgmental. We don't look at how people live their lives. We don't, you know, we kind of try and coerce people into working with us. And if you look at the clutter, we'll go into a property where there's clutter and it will be it'll be messy, it'll be chaotic, but the house, generally you'll be able to move around the house freely, you'd be able to escape in the event of a fire, and there's no real kind of massive issues there. Collectors, we've gone into a lot of collectors where actually they kind of know where everything is and it's stored in quite an organised way. It may still be quite cluttered and it may be difficult to get around the property, but actually collectors are you know, they know where everything is and that they're able to find it and that they can function in their house. And generally, it's, although cluttered, it's a very safe property. Hoarders, however, possessions become organised, preventing rooms being used for their intended purposes, and this in turn affects the health and well-being and the safety of that individual. Next slide, please. You may have seen this previously, and this is what we use in the fire service and our work with kind of adult social care and safeguarding. This is the clutter image rating scale, which was developed by the International OCD Foundation. And in essence, it helps individuals and professionals to determine where a property or a person is in respect of their hoarding. The images represent rooms in various states, and it will have, I mean, if you look at that, it's got a living room and kitchen. It will also have a bedroom on there. So there's 3 or 4 different areas that we can look at. As a rule of thumb, from the fire service perspective, anyone who's moving between 4 to 5 and higher, that reflects a level where we will be concerned about their hoarding and the impact it will start to have on their everyday life, and we would like to get in here at an early intervention before it becomes kind of a higher or a bigger problem. Anywhere on the bottom line you can see there between 7 and 9, we consider it to be a high risk, and we would, from a multi-agency hoarding perspective, which again I'll speak about that later, we would put in a multi-agency referral to work with adult social care, environmental health, mental health, etc., to look at how we can make the property safer and where we can reduce the hoarding. Our best practice, it would suggest that early intervention at the lowest level is really easier for us to work with, but unfortunately from a fire service perspective, when there's a fire, we kind of come across people at crisis intervention when it's too late. You know, they've had a fire already and the property is in a poor state. So we do encourage other professionals that enter properties to kind of report hoarding in as well. And, you know, we've given fire safety advice and training to, it could be to electricians or gas engineers that do the yearly tests in registered providers or landlords or owner occupied properties. landlords, and even postal workers, because the postal workers come to your house kind of most days, and sometimes they can see a property that maybe isn't quite right. Next slide, please. There's various reasons why someone may hoard, and I don't think it's really fully understood why people do hoard. And it could also be a symptom of some other issues within the property. So if someone's got mobility problems, or they're physically unable to clear the amounts of clutter, it begins to kind of build up. Also, we've come across individuals with learning difficulties, or people developing or starting to live with dementia, and again find it really difficult to dispose of items. In some cases, hoarding is a condition within itself, and it can be associated with self-neglect, and that was kind of put into the Care Act in 2014, when self-neglect hoarding was added to self-neglect. And we found from a fire service perspective, the hoarding and the risks increase when people live alone, or they kind of they led a deprived childhood, where there was a lack of material objects, or a poor relationship with other members of the family. The family have a history of hoarding, or these people have grown up in a hoarding or cluttered home, and they see that as the norm. And could you just click the rest? There should be more squares, or not squares, hexagons. Thank you very much. Again, we engage where we can with people with hoarding disorder, and I suppose the most general thing that we come across is people tend to say, oh, I'll keep that because I might need it one day, or they buy things because it makes them happy. And as mentioned before, sometimes people find it really difficult to get rid of possessions because they are from following, the death of a loved one, or a friend, or a family member. And again, I mentioned it earlier, we've seen these shows where, trying to help people to remove some of that really does stir up some strong emotions, and it can be really overwhelming for the person to kind of get rid of it, and they end up putting these decisions off. And while they're putting that decision off, they're still acquiring more possessions, so it's getting kind of higher and higher. And really, you go into the properties, and the value that a hoarder will put on this, ourselves will probably look at it and go, I don't know why you're keeping it. It's either rubbish or it's of no use. However, that person puts a real value on that piece of equipment. Next slide, please. So how big is the problem? The Daily Mail put a freedom of information request into all the fire and rescue services across in the UK. Now, if you look at there, it says that there's 16,000 homes in the UK who are deemed a fire risk because they are piled very high with belongings. We are significantly higher in Merseyside. However, there is a reason for that. We do 50,000 home fire safety checks, and we do 10,000 safe and well visits, and that's substantially more than any other fire and rescue service does in the country. By the very nature of us knocking on more doors, we identify more hoarders, more people with a hoarding disorder. So I think it's probably slightly skewed to say that Merseyside is the hoarding capital of the UK, because I think if the numbers were done by the other fire and rescue services in line with us, they would also identify probably the same amount of people. And also, I would suggest that the 2 years we had with COVID-19 and the pandemic, a lot of contact was done by telephone. People didn't go into each other's properties, and yourself, if you phone a hoarder and you say, have you cleared the hoarding, on the telephone they're going to say yes. So the fact that we weren't crossing thresholds, whilst telephone risk assessments have their value during a time like that, it really doesn't give the true picture, and the person's not going to tell us that they are still hoarding or it's at dangerous levels. Next slide, please. Okay, so what do the fire service do? We are trained. We make dynamic risk assessments on a daily basis. and that transfers into our prevention activities that we do as well. We will go in, our operational crews go in, they would deliver a home fire safety check, which is a low level of a check, but what it will do, our main aim is to make sure that everybody has got at least one smoke alarm at each level of the property. We look to make sure that there's safe heating methods, smoking materials, cooking. Now, all of these are dangerous within themselves. You know, if you mix alcohol, medication, drugs, you know, put it all together in a normal household, that would be a high risk. If you add hoarding, where you're going to have kind of clutter near to a cooker, near to the cooker, near to a fire, and the volume of property materials within a property makes the fire will spread fiercer and quicker throughout the property. So, as I say, generally these risks are there. Add a hoarder to it, and it makes it even harder. So what we also look at from a safe and well visit, it incorporates falls risk assessment, it incorporates fuel poverty, it incorporates smoking cessation and alcohol reduction. So we do work with partners to try and reduce that risk. But as you're all aware, you know, hoarding is not a single agency issue. It's a multi-agency issue that, you know, really needs everyone bought in, and it's difficult to kind of say who leads on it. And I'll come on, we've just spoke about a MARAM process that we work with in Merseyside for people that might not actually reach that safeguarding criteria. However, it's still a problem, and I'll touch on that at the end. And finally, we've got safe and well visits. As I say, our advocates, they undertake brief intervention training around all the areas that we do, and that means they can give advice to an individual who can then make their own informed decision about what we've asked them to do and whether, you know, they have the capacity to make those decisions. Next slide, please. Sharing of intelligence. If you could just click all the shapes for me, please. Again, you know, all of us are involved. All of us go over the threshold pretty much of people's properties, and any agency can refer into the fire and rescue service if they come across a hoarder. And, you know, as I've mentioned, the early intervention really is the key for us here to get in early. The issue, and we come across this quite a lot of time, is sharing of intelligence, particularly around people who do not want to engage with us, which, you know, again, if we get into a hoarder's property during a fire incident, we may never get into that property again. They don't want to engage with us. They don't want to engage with support, adult social care, environmental health. They don't want to give us consent to share and get care and support for them. So, you know, we know, there's a bit at the end around legislation about overriding some of this, and we've got to be careful, because obviously people that live in their own property, we've got to consider GDPR, and we've got to consider Article 8 of the European Convention Rights, which is the right to respect for private and family life, home and correspondence. So we really do have to take those into consideration. Although, you know, as a fire service, we would love to share every time we feel there's a risk. Next slide, please. Although this was in response to the cost of living, the National Fire Chiefs have brought in steps to stay fire safe during the cost of living crisis. But we know that this is going to have a negative impact on the majority of people anyway. And I touched on it before, that when there's a change like this, cost of living or hoarding, people change their behaviours within their own property, which then makes their behaviours more risky because they're trying to save money. They'll use something that's unsafe, thinking that in the long run it will save money. So we've been looking at this to give advice around how to negate those impacts on people's safety. So this the cost, there's a booklet online, and I'll send a link to it afterwards if people would like to have a look at it. And in effect, this is encouraging people to stay fire safe, protect themselves from accidental fires in home, and also the issue around carbon monoxide, where people are taking those risks. This also shares advice around heating appliances, carbon monoxide, smoke detectors. A key area of this is signposting individuals where additional help could be available from other partners. And there's a point here around, if anyone's aware of the smoke and carbon monoxide alarm regulations 2022, the recent amendment that was brought in on the 1st of October. This is that every property from a registered provider or a private landlord must have smoke alarms and a carbon monoxide alarm. And I can't stress enough around having working smoke alarms in a property, particularly for a hoarder, because those additional seconds can make the real difference around them escaping from the property and not escaping. Next slide, please. Okay, we'll touch on this. This is a case study from Merseyside Fire and Rescue Service, and it really brings what we've discussed there around hoarding to life. This was an incident, and it was in 2016, so it's kind of 6 years old, but it's still really pertinent, and we still use it to cite issues when we're working with partners. It was on Sunday the 23rd of October, and it was at 15:39 hours. Our fire control mobilised 2 appliances to a property. We'd had numerous calls that there was fire coming out of the roof of this property. For those, it was in Allerton, Liverpool. For anyone that knows Allerton in Liverpool, this is Mather Avenue. It's one of the main arterial routes that runs from Liverpool John Lennon Airport into the city centre. So it's a really busy road, and we've received numerous 999 calls. The first appliance was there in under 8 minutes, and when they got there, the officer in charge saw that there was smoke issuing from the roof, issuing from the front door and the rear of the property. All the windows and doors were secured, and by looking at it and the state of the property, we kind of thought it was unoccupied. You can see from the picture there, our first attempt was to access the property through the front door. So we smashed the glass plate to try and get in, and we obviously would put fire officers in breathing apparatus to go in and search the property. But as you can see there, there was absolutely no way you could get anyone into that property. That was behind the front door. And it wasn't until we investigated later that we got kind of a feeling for how the property was being used. But obviously we turn up, we don't know anything about the people, we don't know anything about the property, and our first kind of concern is to get into the property to search it. So that was all behind the front door. Next capacity, please. Next slide, please. Okay, so we went to the rear of the property, and again, that was our next sign, our next attempt to get into the property. You can just see at the top of the, we cut the glass with a reciprocating saw to try to make entry. But if you can see there, the beams have collapsed because of the weight, the fire on the top, and where we were putting water onto the fire. The whole property is collapsed inwards, and the beams have rested on top of all the hoarding that was in that back room. We also tried to get in just to the right of that. There's a kitchen door. We tried to get into there, and as you pushed it, you couldn't push it any further. It wasn't big enough to slide someone through the door, particularly with a breathing apparatus kit on your back. Subsequently we found that there was a new kitchen in there still in the box, and there was 10 microwave ovens in there as well. So there was absolutely no way we could get in. Again, we continued firefighting into the night. The main arterial route was closed, and again, as I mentioned earlier, the fire spread very quickly because of the density of kind of clutter that was in there, and it was so tightly packed together. We had a multi-agency meeting, and we decided we didn't know if anyone was in the property at this time. We didn't know if they were away on holiday. None of the neighbours knew, and this probably shows how much they kept themselves to themselves. One neighbour said they were husband and wife. One neighbour said they were brother and sister. So nobody really knew. Eventually, the decision was made that the only way we was going to be able to search the property was to excavate it from the roof down. And that would have to be, as we didn't know people were in there, it was just nibbling it piece at a time, keeping a look in case we did actually uncover any person within the property. We also, we kind of, I haven't got all the pictures here, but we kind of took the top floor off, so it was excavated down. Then we tried, we had a snake eye camera where we tried to look into voids to see if people were in there. Eventually we got to a point where we used 3 of our search and rescue dogs with the police. One's trained to locate and identify living persons, one's trained to identify deceased person, and one is trained to detect accelerants, because we couldn't rule out at this point whether it was an arson attack or not. It was at this point that the dog at the front of the house identified that there was at least one deceased person in the property, so we kind of knew what we were working with. Then we eventually got excavation down to the ground floor, and we uncovered the arm of an adult male that we found there. So we done a kind of a controlled and methodical search around that body, and it was at that point we found Mr. Kane's wife. He was a 72-year-old male, she was a 75-year-old female, and they were literally living within the front room in such a small space, 2 armchairs, a microwave oven, and an electric heater. So we began to get a picture of what we were dealing with, and the investigation that opened up some of the issues that I'll come on to later. But we do know that we had tried to engage with these previously. Next slide, please. This is the place as it is today. As you can see, you know, it was a semi-detached house which has now been excavated to the floor. We removed 26 20-ton skips were used to remove it. The fire service were involved, Merseyside Police, Liverpool City Council, North West Ambulance Service. The main arterial route was closed for 7 days. It became a crime scene at one point. So you can see, when I mentioned earlier and saying there's this kind of, you know, people say, oh, hoarding's a bit of a nuisance, hoarding as eccentric people, it's this, that. This is a real kind of, this shows really where hoarding can lead to, and the cost that it really, and what it cost across all the agencies that were involved. Next slide, please. We put it in for a safeguarding adult review because we felt there was possibly some issues where agencies could have worked better together. And although it was found not to meet the criteria of a safeguarding adult review, it was considered that it should be around a lessons learned exercise, which is where we've been around presenting that a bigger version of that presentation across the Northwest and nationally. So that fell out of it. The legal department for the Adult Social Care in Liverpool City Council said, in hindsight, there are some other issues that, moving on, if we come across something similar, we should consider these legal considerations. Now, the first one is the Care Act 2014 statutory guidance. They said, consideration should be given to raising a safeguarding concern and, if necessary, override the individual's wishes. And I think that's probably quite important. We've, as a fire service, we really learned a lot from this, and some of these were, we may have used them if probably at the point we'd have known. Again, the Care Act section 42 is to say ascertain if they have sufficient care and support needs or if they need them addressing. The Housing Act, if you look at the Housing Health and Safety Rating System, there's 29 separate hazards that must be considered for a property to be considered safe. The only thing is this pertains to the physical structure and fabric of the property. So it would have been very difficult for us to make that call. But when you look at the pictures you've just seen, obviously the amount of hoarding that he had in a property was a structural risk, because we've put a bit of water on top of the fire and it's collapsed inwards. Statutory nuisance, this was put in there, but it didn't really apply to this. This is around health, noise and smells, and that wasn't a factor in here, but it could be around a hoarder. Filthy and verminous. The neighbour had complained on a couple of occasions around a rodent infestation. The local authority laid traps outside the property but couldn't get inside to obviously because he wouldn't allow access. But there was no evidence of a rat infestation, so they couldn't have used that to. Capacity Act, obviously we've got this here. You know, if we think that someone doesn't have the capacity to make safe decisions, we can consider doing that. Again, we did speak to Mr. Kane prior to 4 months before, and he seemed to understand the risks of fire. He seemed to understand what he was doing, and as I say, we couldn't get access to the property. There's an interesting point here around the High Court inherent jurisdiction, because this covers people who are not under the provisions of the Mental Capacity Act, and the wording here is, but where a vulnerable adult is or reasonably believed to be for some reason deprived of the capacity to make relevant decisions or disabled from making free choice. So there was during the investigations after, and it's very difficult because you can't speak to the people that were involved. However, there was some feeling that Mrs. Kane didn't really want to live in the way they were living and she wanted to move. And there was some kind of coercive control by Mr. Kane. Again, that's only from speaking to neighbours and other partners that were involved, but it's something to consider again. And obviously the last couple there, Mental Health Act, you know, it's around section 115, which can get an approved mental health professional to enter and inspect the premises, or section 135 of the Act, where police can remove the person from the property for their own safety for up to 72 hours with a view to making a detention if it's deemed appropriate. Okay, final slide, please. There should be another slide there, but don't worry, I'll speak about it anyway. It's missing. Don't worry, I'll speak about this one anyway. What we did, because moving forward, we wanted to make sure that we weren't in this position again, that we weren't in a position where we're trying to decide who is the lead professional agency, you know, who does what. So we the coroner put in a regulation 28 that was around, you know, it's to reduce future deaths. Now, he was under the impression that the fire service could enter, get powers of entry to enter a premises, but we do not have those powers of entry in a domestic dwelling, only if it falls under the Fire and Rescue Services Act 2004, where an authorised officer of a fire and rescue authority can enter a premise if it believes the need to discharge the core function of firefighting. In essence, that means if we think there's a fire in there, we can break into the property, but that's the only way we can do it. So that was that regulation 28 was submitted to the Home Secretary around changing legislation, which was at the time it was Amber Rudd. She said that it was a significant and disproportionate regulatory burden for homeowners, as the majority of people, as they are safe in their home from fire. But what she did say was that you need to work in a multi-agency way to make sure that you use the existing legislation, similar to what we've just discussed on this slide here. So in Merseyside, and I think this is pretty much across the country now, there are multi-agency hoarding protocols, which allows us, other partner agencies that come across hoarding, to refer in if it's of a sufficient level, generally 7 to 9, to put it in for a safeguarding intervention, and then it's considered under a multi-agency approach. So really, you know, just to finish off this presentation, hopefully that has shown that, you know, hoarding is a bit of a complex disorder that really does require the support of a number of agencies. You know, none of us can do it on our own. None of us can own it. Yes, it is a fire risk, but it's also a mental health risk. It's also a risk to neighbours. So the key for us is to get in early in these properties, and when we identify an early stage, we can manage it there. We don't want to be going in, you know, at the complex end. It's, you know, it's not safe for the person living there. It's not safe for the neighbours, and it's certainly not safe for us to commit our firefighters into a property very similar to that one. Because if we had got, you know, if there'd have been a small space for our crews to get in. We would have gone into search, and the fact that it just collapsed inwards, we're looking at a very different kind of situation then. So I'll open up. I don't know if there's any questions on the back of that around the fire service and hoarding.
Ravinder, do you want me to lead on this bit?
Yes, please, Kenny. Thank you.
So thank you, Kevin, for a really interesting conversation and a case study as well. There's loads of comments, so I'm going to thematically arrange the questions. But a question from my point of view as a practitioner, sometimes in the field and sometimes not. It was interesting to see that you've got the OCD Foundation clutter rating. Has any work been done at an integrated care level with the named practitioners in health, so named GPs, named adult safeguarding leads and designated professionals to see whether the clutter rating might make a useful launch pad for conversations about making referrals for hoarding syndrome? Has anyone used the OCD framework of clutter rating?
Yeah, I mean that in Merseyside, that is incorporated in the multi-agency hoarding protocol, and the idea is really to kind of have that conversation with the person in the property and go, we've got this, we think you're around here, where do you think you are? And you know, generally there's a very difference of opinion around that, but it's kind of stimulates that early conversation for us. But yeah, I'm not sure, Kenny, how widely that is used by other partners.
Well, we've certainly got or had and will have 600 colleagues on this call. So hopefully, colleagues, if it isn't part of your partnership hoarding control and support protocol, then the OCD Foundation clutter rating images might help you have that initial conversation. It feels very strength-based. That's why I'm asking, Kevin. It brings the family and the person into the conversation, because I have been one of those nurses. I've said it several times in public. I've been one of those nurses who, in my wisdom as a clinician, have gone in and I've cleared people's houses.
Yes.
I've cleared them of their memories, I've cleared them of their legacies, because I thought I knew better. I will never do that again, but, you know, that sort of, I didn't have the tools and the knowledge in the 1990s to appreciate how traumatic clearing was versus controlling someone's hoarding through that programme. So thank you, you brought a solution for me. Right, many of the questions are about the exemplar. Before we come on to the legal things, this fire safety and welfare check visit.
Yes.
How might our 600 plus colleagues make an arrangement for one of those? Is there a referral process, or what do they do to line up an arrangement if they're visiting or they're cognizant of possible self-neglect and hoarding signs?
Every fire and rescue service will have a referral process that if you look on the website, it will go, you know, refer for a home fire safety check or a home fire safety visit. They're called various different things. So, and if not, phone your local fire and rescue service and say you've got concerns about a property. We can't always, what we will do, obviously, we will always ask if we got consent for us to contact the person, which is probably the easiest way for us to go. If you haven't, what most fire and rescue services will do, we will send an appliance up and down that street, just knocking on each door. So it looks like a routine prevention activity rather than focusing or targeting a certain property. We will know that number 52 is the property we would like to get into, but they won't know that, you know, that's been phoned through, that they're considered a concern. Ideally, we would like to work with the person. But there's also a national online home safety check tool now that you can use, which is linked to fire and rescue services, and it will walk you through the risks. So you can do it yourself or you can do it as a partner, and that will create a visit within the service. And I'm happy to share that link afterwards.
Marvellous. And when you share it, Kevin, we will put it in the legacy document that is in Futures NHS as a helpful resource. That's really helpful there. There are several questions that revolve around what about the safety of and the welfare of friends, neighbours, etc. Do you have any sage advice in your experience about the impact on neighbours and friends, particularly invisible neighbours that may not be able to use their voice and express their concerns? What can they do to support the self-neglect hoarding person they live next to?
Yeah, I mean, generally, when we're working with hoarders, we generally work with the neighbours and family anyway, because it's a lot easier to have that conversation. And then the family or the neighbour, who often has a key to the property or access to the property, will then go and speak and go, the fire service want to come in. They just want to fit smoke alarms. They just want to check you've got an escape route. They just want to check you're safe. They don't want to take any of your possessions away. That's ideally, having those neighbours and friends are really good in for us. With Mather Avenue, I think what was interesting as well was Mr. and Mrs. Kane were both with different GPs, and they were getting medication delivered to the neighbour next door, but they never came to collect it. And often when he was going to deliver it, he ended up sending the medication back, saying because he couldn't contact them, they wouldn't answer the door. And again, we looked at that and go, is maybe that a point that we're sending repeat prescriptions, or should the GP be going, actually, they're not picking their prescriptions up? Is that an identifier as well that should be going into, mental health or adult social care or somewhere? But yeah, as you say, generally we are it's really useful to have friends, neighbours that have got that contact or referring to us.
We've got several examples and exemplars across the system. Our colleagues have been very kind at posting where strategic partnerships and joint working and collaboration is indeed working, and we will leave colleagues to look at the spaces and places where it is happening. Thank you for that. Some real exemplars across the country, and what I will do with the team, if you don't mind, is we will collect those and maybe work at a later stage around creating a legacy of these spaces and places that you've been clearly saying this is already happening across those spaces and places. One of the issues that has been arising is, in your area of subject matter expertise, is there, in your opinion or your organisation's opinion, an unwarranted variation in these risks within private rented accommodation, council-owned accommodation, or social services type accommodation? Is there a type of landlord or ownership that tends to be worse for self-neglect and hoarders to be living in?
Yeah, I mean, generally, we find that owner-occupiers who are in their late 70s or 80s and have lived there all their life, or maybe inherited the house from their mum and dad. So you've got generations of people living in that house. They may live alone. They tend to acquire possessions throughout the years, not get rid of them. So we do tend to find older people living alone. Owner-occupiers is one of our big problems. Registered providers and social housing is generally very good, because they do go in and do yearly gas and electrical checks. So they every 12 months they should be getting in the property, and if they can't get in the property, they should be writing to get access to that property. So they're good. Rogue landlords, poor accommodation, again, is another one we have issues with, because the landlord doesn't want us coming in their property, because we will report substandard living conditions, poor conditions. So really, if you look at the two main areas, poor landlords and owner occupiers in their late 70s, early 80s, etc., are our main areas of concern.
Yes, thank you for pointing that out. When you're describing it, it makes absolute sense. but it needs a moment like this just to think about those layers and history of generational hoarding has that impact. Someone's made a really interesting statement on the clutter image scale in terms of adults with learning disabilities, but find that the picture is of clutter, but it's also soiled clothing, dirty plates and empty food containers, which is more of an infection prevention control issue if we're clinicians. What would you say about that?
Yeah, I mean, we come across, as I say, for us, the biggest issue around the hoarding is when it's no longer used as it should be used functionally. And generally, that's where we find the kitchen. We'll go into the kitchen and they can no longer use the sink because it's piled high with plates. There's rotting food. We'll check the fridge. There'll be either no food or rotting food in the fridge. The toilet will have hoarding. There's no sanitation. They can't use the toilet. We've found we've been into properties where someone's urinating into 2 litre bottles and they just leave. They accumulate as well. So all of a sudden, all of those factors now are kind of contributed because of hoarding, but you're moving from hoarding into that massive self-neglect of their health and well-being, of their sanitation. So all of a sudden that hoarding is now having a kind of bigger effect on that individual, and it comes back to what I said sort of at the start of the presentation. People change their behaviours, and once people start changing behaviours, that's when their risk will all of a sudden start going, around fire, around their health. It really does. It's one of those kind of cylindrical things that you need to kind of put a stop to it. Otherwise, it will just it's spiral onwards and upwards.
Yes, and certainly from a health practitioner's point of view, once you get into that spiral of lack of control of an infection, etc., wound management becomes an issue, and nutrition becomes a challenge as well. Lee's asked about preventative measures, Kevin. Is there quantifiable audit information about how successful the preventative measures have been, i.e. where possible fire risk has been reduced because of the proactive actions?
Yeah, we've had this conversation for years, Kenny, around evaluating how successful is our prevention. If we go into your property and fit 2 smoke alarms, your property is safer. You will get kind of notified earlier if there is a fire. But if you never have a fire, how do we know that we've prevented you having a fire? And this is very similar with hoarding. Although we've got a 12-month revisit. So what we will do is we'll look at where we were this time last year, and then we'll go back in 12 months' time. It'll either be worse or it'll be better. So we've got the University of Liverpool that are doing a socio-economic value on the prevention that we deliver. Whilst it's probably more around monetary and what we save economically, but it also looks at, where have we reduced the risk in properties? But as I say, like we go out, we do 60,000 visits a year. We fit smoke alarms, we fit fire retardant blankets, fire retardant throws, oil-filled radiators. So we're constantly reducing risk, but I don't think we'll ever know which person we stopped having a fire. It's really difficult to evaluate.
Yes. There is a host of questions and comments about the legislation. There always is, Kevin. I think people are impressed with your ability to reference various multi-agency, multi-service legislation, which is more rounded than just being health legislator or social services legislator. I'm just wondering, in your world, is there an inspiring summary or rapid read that we could maybe share, or could we work collaboratively between ourselves, you being Blue Light and NHS Safeguarding and the 600 safeguarding people on here? could we work collaboratively around summarising these laws if you don't have one already?
Yeah, we don't have a summary of it, and you know, it's something that, as I say, it was put together by Liverpool City Council, and I do, whenever we come across a hoarder, I do refer back to these. But yeah, it may be something that we could look putting together, really, and you know, I did really just summarise and you know, I'm no lawyer or solicitor, so I put it in a very simplistic version of what I understand of what it is. But you know, you've got probably about 7 or 8 different ways to engage with someone who doesn't want to engage with us, and yeah, there probably is something in that, Kenny, in putting some kind of simplistic overview of what other, and that may be in the multi-agency protocol or in a MARAM process, whatever's local. But yeah, I think there would be value in that.
So on behalf of the 640 people who did attend, we will take this as an action on your behalf to not only work with colleagues such as Kevin, subject matter experts in the field, but we'll also perhaps work through an integrated care partnership model to bring something that is akin to a rapid read. So because that will answer things to the question. So colleagues, look out for that over the next 2-3 months. We will work on that as part of these reflections, and I am certain the NHS safeguarding team is doing that. There have been loads of personal stories, family stories, professional stories, and we'll leave people to read this. There's an abundance of comments, there's an abundance of suggestions, there's abundance of excellence here. Kevin, my last question for you. How does your team restore their confidence and restore their own coping strategies when they deal with such tragedies that you described for us?
We've got two different coping mechanisms, really. If we attend a fatal fire or a serious incident, we've got a team of defusing officers. So what would happen is, if we've been to a traumatic or serious incident, when the crew return to station, we will immediately mobilise one of our senior officers to go there, sit with the crew and look at the coping strategies. Do they need any additional support? You know, are they okay? You know, it's easy for us to say it's part of the job, but you know, you sometimes get someone who's only been in the job a couple of weeks. They may go to a fire fatality or a serious incident. So, you know, I think we recognised some time ago we was a bit blasé around the way we did deal with trauma, and so we've really made an effort around this defusing. So everybody is defused post-incident. We make sure everyone's okay. We've got a chaplain on hand, you know, we've got a fire service chaplain, which we will call in as well if necessary. Similarly, for our advocates that go out and do the high risks, they are subject to professional supervision every month by one of their managers who's trained in the supervision of them. And, you know, again, we look at trauma informed, we make sure everyone's okay. So, you know, it's probably one of the pluses, one of the good things that we do within this job. We recognise it's a tough job. We recognise, you know, we see things that maybe not everyone else does, and you know, we address that and we deal with it, and I think it's been quite successful.
Good. Well, on behalf of 620 safeguarding colleagues, thank you for doing what you do. I'll hand you back to Ravinder. Thank you.
Thank you.
Thank you. Thank you, Kevin, for an incredible, informative and powerful presentation, highlighting the complex disorder of hoarding and the fact that it requires a multi-agency approach. And thank you to everyone for joining today's event. These sessions were created after listening to you and what you needed to learn. So what can you do after this session? We all need to actively listen. We need to believe what we hear, and we all need to do something to improve trauma-informed services for victims and survivors, whilst preventing perpetrators and disrupting offenders. The National NHS Safeguarding Team will prioritise listening to you when you need a listening ear. Ongoing learning will support you to be more professionally curious, help you avoid re-traumatising the people you support or care for, and support you to find moments for self-disclosure. Please do join our social movement. Let's learn together and support each other in our new normal. NHS Safeguarding will be back tomorrow at 12 with day 3 of our Learning Together week with our host Bex Reynolds, National Safeguarding Clinical Lead, and presenters Dr. Bryony Kendall, Dr. Sharon Dixon and Donna Love, who will be delivering a session on FGM, forced marriage, virginity testing and hymenoplasty. Enjoy the rest of your day and we look forward to welcoming you all tomorrow.